Hello, everyone. My name is Anne Baptiste. I am currently enrolled in the BSN to DNP program with a concentration in pediatric health at the University of South Florida College of Nursing. Today, I have the pleasure of interviewing Dr. Smith. Dr. Smith is the current concentration director for the Pediatric Nurse Practitioner programs at the USF College of Nursing. Today, we'll be discussing global health and the current COVID-19 pandemic. First off, thank you so much for being here, Dr. Smith. To begin with, can you tell us a little bit about yourself and about how you got into the field of global health?
So thank you for inviting me, Anne. It's good to see you again. My actual first global, if you will, encounter with global health was with you on a trip to St. Croix when you were an undergrad student. I would say I'm an adventurous soul. I've been a nurse for many, many years, and have had, global is depends on your definition. When I was about 30 years old, I left Miami and the safety of home and moved across country to a town of 200 people in Montana, where I worked with Northern Cheyenne and Crow indigenous people on the reservations there. So that kind of gave me a taste of there are many, many cultures living with it just within our own world, our own microcosm of a world. Since our trip to St. Croix, I have gone to Honduras and Peru, and I was planning to go back to St. Croix. I believe you were going to go with me as a grad student. And then, of course, the pandemic hit, so we've had to adjust our plans just a bit.
Why do you believe global health is important?
I believe global health is important because while we think we live in a big old world, we're all about 3 hours away from each other, if you will. I can be any place on this planet in less than 24 hours. It's important because what I see occurring in other countries will be coming to a town near me, very possibly. And flu every year is a prime example of that, as is the COVID pandemic. I was talking to some students in my clinical practice just a couple of weeks ago. We had a child come in with an enlarged lymph node in their neck, and I was asking them what the differentials could be, and I said, well, don't forget about diphtheria, and we don't think about diphtheria because we have a vaccine for it, and no one has seen it in real life in this country in many years, if you will. And sure enough, I just saw that they were having an outbreak of diphtheria in Peru, where I was just 8 months ago. So you never know. You need to be aware of what's going on in the world around you in order to know what is going on in the world near you.
What has been your role so far in fighting the COVID-19 pandemic?
So, educating future nurse practitioners and teaching you all about the impact of the pandemic and the disease itself. I do practice clinically in addition to teaching. So I'm seeing patients, children and families who are coming in for testing, but also who are coming and testing positive. So how do you treat those children and the families?
What do you think right now is the hardest part about providing the public with information about COVID-19?
I would say dispelling myths, if you will. Everyone likes to consult Dr. Google before they consult their doctor themselves, which is good and bad. So they come prepared with an idea, and they come prepared with questions, which is important. But they also, their sources may not be the most evidence-based. So part of my job is to say, well, what website did you see that on? And let's take a look at that website and see if we can, identify the truth and the fiction of, that lies there. And calming people's fears, and simply calming people's fears. Everyone's scared to death, and rightfully so. But, we have to, help people calm their fears, because staying isolated and not interacting with other human beings other than virtually can lead to its own issues.
For my final question, in your opinion, what must happen to end COVID-19 pandemic?
Well, a lot of things probably. There are several options. The virus could attenuate and get less and become one of the other 4 or 5 strains of coronavirus, because we have about 4 or 5 strains out there, and kids get it every year. Not COVID-19, but one of the other corona strains, and it's a common cold. So that could happen. That would be wonderful. COVID is not going away. The virus is not going away. So we have to learn how to live with it. So I think really to happen is we have to have a vaccine that's distributed globally. I'm amazed at how quickly researchers, drug companies, and governments worldwide have come together to get a vaccine or multiple vaccines to clinical trials. I'm hopeful that we will be able to mass distribute it, that it will be effective. Whether it's something that we end up having to take every year, like the flu vaccine, or if it's something that you get like one and a booster, like the measles, will yet to be seen. But I think that's kind of the key, and that has to be a global effort. We can't vaccinate in this country and not in all countries, or it's gonna keep causing the death rate to be high. So
I agree. One of the biggest things you're hearing now is how a lot of people are cautious about the vaccine and the speed of which it's coming out. So I think it's just really having faith in the scientists around the world, the CDC, the World Health Organization, and really putting faith that these are top tier intelligent people who know what they're doing, and trusting in them and going forth with what we say.
I think, people remember that how long it took to get the polio vaccine, the chickenpox vaccine, but all of those vaccines, I don't think we've really had a vaccine created since the internet has been ubiquitous across the globe. So, things move at light speed now, including, I guess, vaccine development. So our job as providers is to make sure we provide good education, to ask the questions of the families, to find out why they're reticent to take the vaccine, and then help educate them in an evidence-based way so that they can make the best decision for them and their family and their global community.
Yes. That was all the questions I have. Again, thank you so much for doing this interview, Dr. Smith, and it was an absolute pleasure to interview you today.
You're most welcome, Ann. It's good to see you.